Welcome to the Baptist Health Doc to Doc podcast, a conversation for physicians by physicians, providing insight on the latest in medical practice, research, technology, and innovation in healthcare. Join Baptist Health experts as they offer practical advice for clinicians covering a wide range of specialties. Cancer, neuroscience, orthopedics, and cardiovascular care are just some of the timely discussions you'll find right here on the Doc to Doc podcast.
I'm Dr. Michael Zinner, CEO and Executive Medical Director of Baptist Health Miami Cancer Institute. I'm joined today by my colleague, Dr. Manmeet Ahluwalia, who's Chief of Medical Oncology, Chief Scientific Officer, and Deputy Director of Miami Cancer Institute, and the Fernandez Family Foundation Endowed Chair in Cancer Research. I'm thrilled today to talk about our research led by investigators at Baptist Health Miami Cancer Institute. Several of our physician researchers presented their studies at this year's ASCO annual meeting in Chicago. We're excited to present our findings because many of these landmark studies are transforming care, extending lives, and improving the quality of life of our patients. Dr. Ahluwalia, glad to have you join us.
Thank you so much, Dr. Zinner, for your kind introduction. And I'm excited to share some of the findings that several of our investigators led and presented at ASCO this year.
Okay, Dr. Ahluwalia. Overall, it's been a really exciting past few years for us at the Institute as we've expanded our efforts in the research space. Let's set the stage. Can you chat with us on how much we've grown in this research space over the past few years?
Sure, absolutely. So I think our research program has grown tremendously in the last 4 or so years. As you can note from the number of presentations we have had at ASCO. In 2021, we had 3 accepted abstracts at ASCO, which has now grown to 56 accepted abstracts that we had at ASCO 2024. And we also had some really groundbreaking research presented at oral presentations, which may change the standard of care in patients with brain metastases worldwide. So it has been an exhilarating journey to see this transformative change in research that is being led out of Miami Cancer Institute in collaboration with top researchers all over the world to transform lives of patients with cancer.
Well, you know, we really could not have done this without your continued vision for our institute. And since you're just back from ASCO, can you share with us some of the impact of the work you've presented about brain tumors and specifically glioblastomas, GBMs, and what you presented at ASCO, and maybe go into some detail about the trials that we were so proud to present that came out of the work of Miami Cancer Institute?
Absolutely. So brain tumors in general refers to brain metastases. These are cancers from rest of the body that go to the brain, or it refers to primary brain tumors that arise in the brain. So specifically, I think we led several studies in the arena of brain metastases, which refers to cancers from the rest of the body that go to the brain. Each year, approximately 200,000 patients are diagnosed with brain metastases. So it's a very common clinical issue that we see in our clinics every day. We are lucky to have some of the world's greatest researchers in brain tumors here at Miami Cancer Institute. And I would like to start off with an abstract that was presented by my colleague, Dr. Minesh Mehta, who's the chair of radiation oncology here at Miami Cancer Institute. Minesh presented findings from METIS, which was an international multi-center phase 3 randomized study evaluating the efficacy and safety of tumor treating fields in non-small cell lung cancer patients with brain metastases. We know that lung cancer is the most common cause of brain metastases that we see. Approximately 50% of patients with stage 4 lung cancer will develop brain metastases. And half of the patients that we see in clinic with brain metastases have lung cancer origin. So this trial actually looked at close to 300 patients that were randomized all over the globe, looking at radiosurgery, which is a focused form of radiation delivered to the brain, with a combination of tumor treating fields, which is a way of delivering electric fields to the brain to basically stop the cancer from growing in mitosis or cell cycle. This modality is approved for patients with glioblastoma and is used in clinic in the United States and Western world. This trial looked at, could we improve the intracranial progression-free survival in patients if we applied electric fields in addition to radiosurgery, which is the foundation of treating these patients. And what this trial highlighted was that there was an improvement in almost doubling of progression-free survival from 11 months in the control arm to approximately 21 months in the experimental arm. That means addition of tumor treating fields slows the growth of existing brain metastases. This result was received with a lot of enthusiasm at ASCO and led to an oral presentation by Manish Mehta. And I think this will serve as a foundation for launch of several trials in follow-up. And the good part for us is that researchers from Miami Cancer Institute have leadership positions on this study and the upcoming studies. We were also thrilled to present a phase 1 trial of tucatinib, trastuzumab, and capecitabine, again with radiosurgery in patients with brain metastases from HER2-positive breast cancer. 20 to 25% of patients with breast cancer have HER2-positive disease. These patients have a higher propensity to develop brain metastases. And again, as I had outlined before, radiosurgery is the foundation to treat these patients. This is clearly shown to be better than whole brain radiation in terms of cognitive challenges that we face when we give patients with whole brain radiation. Hence, the effort now is, can we combine these targeted therapies along with radiosurgery to make the outcomes of these patients even better? So this trial that is being led out of Miami Cancer Institute, of which I have the privilege of serving as the principal investigator, is supported by numerous grants from V Foundation, Swim Across America, and the International Radiosurgery Research Foundation of the world. And this is looking at a combination of this new targeted drug called tucatinib that is shown to be beneficial in these patients, combining it with radiosurgery, along with trastuzumab and capecitabine, which are the common chemotherapies used to treat these patients. We are partnering with several institutions from International Radiosurgery Research Foundation of the world to accomplish this trial. Another study that we were very excited to present at ASCO was a study led by a colleague of ours, Dr. Rupesh Katocha, which looked at phase 1/2 study, looking at safety and preliminary evidence of therapeutic effect of exhilarated, again with radiosurgery. RAGE, or receptor for advanced glycation end products, is a receptor that leads to proliferation, invasion, and gives a preferential advantage to the cancer cells. Exhilarated is a small molecule inhibitor of this RAGE pathway. And what Dr. Katocha is trying to see again is, can we combine this inhibitor along with radiosurgery to improve the response rates? That means, can we shrink more tumors going forward compared to what we can do with radiosurgery alone? Essentially, the theme here that you're seeing is that research from Miami Cancer Institute, in collaboration with major cancer centers around the world, is trying to improve on outcomes of patients with brain metastases, building of the foundation of this radiosurgery. As you know, Miami Cancer Institute houses some of the top modalities to provide radiosurgery in the world. Under your leadership, we've been able to get CyberKnife, we have ZAP, and we also have Gamma Knife. These are different platforms to deliver radiosurgery.
Well, you've talked about certainly the brain metastasis program that you have. Are there others that you can talk about? For example, work with brain metastasis from, let's just say, breast cancer, or actually even some specific ones, not even about metastasis, but about the glioblastomas themselves.
Certainly. Again, we presented several abstracts at ASCO looking at glioblastoma. One trial that is a multi-center study of 11 institutions across the United States that we have the privilege of leading is a trial called SURVIVE, which is a multi-center randomized control study of Survivin vaccine, Survax-M, along with temozolomide for newly diagnosed glioblastomas. We know that the outcomes of patients with glioblastoma is fairly dismal. Despite the advances in surgery, radiation, and chemotherapy, unfortunately, most of these patients survive 16 to 18 months. And there's an urgent need for newer novel therapies to improve outcomes of these patients. So this study is looking at over 240 patients, trying to see if this vaccine, which targets survivin, which is basically an intracellular protein which gives advantage for a cancer cell to continue to grow and basically become immortal. So this is a peptide-based vaccine that targets this protein called survivin, which is presented in almost all glioblastomas. We have presented earlier results from a phase 2 trial showcasing that the use of this vaccine along with chemotherapy and radiation improved survivals from the historical benchmark of 16 months to 26 months, which has been highly gratifying. Hence, this trial, which is now fully enrolled, is looking at in a randomized phase 2 trial that can the survival of these patients be further enhanced with the use of this vaccine. So stay tuned. We should be hearing some results from this trial either later this year or next year to see what is the effectiveness of this vaccine compared to the standard of care. Another trial that we were very excited to present at ASCO was this multi-center trial of using low-intensity focused ultrasound called LIFU for blood-brain barrier disruption for liquid biopsies in glioblastoma. Again, as you know, in cancer these days, there is tremendous excitement about liquid biopsies, which is basically taking a blood from a patient with cancer to see how are we measuring either the cell-free DNA that is coming from the tumor of the patient to understand is the patient responding to the drug or is the patient progressing. And in case they are progressing, the beauty of such tests is compared to imaging, which only tells you whether the patient is progressing or not. With liquid biopsies, you can understand the mechanisms of resistance. Why is someone's cancer growing or not responding to the current therapy? So that really opens the avenues for novel therapeutics and clinical trials to target those avenues of progression. Unfortunately, in glioblastoma, we know patients have a lining around the brain called blood-brain barrier, which makes it difficult for the drugs to go in, or also makes it difficult for us to get the cell-free DNA in the blood test. And it's extremely difficult to go in and biopsy the brain every time someone has a progression. So we are partnering up with numerous institutions around the globe, looking at use of this low-intensity focused ultrasound. And Miami Cancer Institute, again, was one of the first institutions in the country to get this modality. And we are partnering with Mayo Clinic, University of Toronto, University of Maryland, along with several other leading institutions across the United States and North America to see if use of this disruption of blood-brain barrier can increase the cell-free DNA that we can find, which we think, if we are successful in doing, will be transformative in defining the next cadre of trials using these novel therapeutics to target these genetic alterations which drive someone's cancer. We were also excited to present a randomized trial of nivolumab along with bevacizumab for patients with recurrent glioblastoma. This was a concept which we had partnered during my time at Cleveland Clinic, along with Dana-Farber, where we looked at nivolumab, which is an immunotherapy that has shown to be beneficial in patients with lung cancer and a number of other cancers, including melanoma, where the use of that drug, along with bevacizumab that targets new blood vessel growth, can lead to a better outcome in patients with recurrent glioblastoma. Unfortunately, in this trial, we did not see any benefit with use of nivolumab with either low-dose bevacizumab or standard-dose bevacizumab in patients with recurrent glioblastoma. However, we were able to identify a gene signature looking at myeloid-derived suppressor cells, and we could identify the cadre of patients who would get benefit from nivolumab and bevacizumab. And we are further expanding this to see if we can look at this targeted approach in a follow-up trial going forward. We were also very excited to present another trial in brain metastases with breast cancer, as you had previously alluded to. And this was a comparative survival analysis of patients with HER2 low and HER2 positive metastatic breast cancer with and without brain metastases, with a very interesting drug called trastuzumab deruxtecan. And as you know, Dr. Zenner, there's a lot of excitement about antibody drug conjugates in the last 5 or so years. Basically, antibody drug conjugates are smart drugs, which basically use a Trojan horse strategy to get into the cancer cell, which then is tagged to a payload, which is basically a cytotoxic agent, which basically goes off in the cancer cell. And as a result, can spare the adjoining normal cells. When we used to use chemotherapies before, we would basically go and kill every dividing cell in the body. And hence, we also saw a lot of side effects like low blood counts, amongst other side effects. These antibody drug conjugates are transforming outcomes, and particularly this drug has really been a game changer for patients with HER2 positive disease, but also HER2 low disease with breast cancer. And so this effort was led by one of our own fellows, Dr. Vivek Podar, who looked at Guardian Research Network, a group of institutions which you're well aware of since you serve on the board of that conglomerate. We looked at 7 different cancer centers in the country, and we looked at the benefit that patients got when they got this drug called TDXT, whether they had HER2 positive disease or HER2 low disease. And what Dr. Podar showed at ASCO, that patients who have HER2 positive disease get greater benefit with the use of TDXT, which is intuitive and supports the mechanistic use of this drug. Hence, we are trying to define the next cadre of trials. And as you know, we were extremely excited to get $1 million grant from state of Florida now to look at TDXT along with radiosurgery in a multi-center trial that will be led out of Miami Cancer Institute, combining with the 4 NCI-designated cancer centers in the state of Florida, including Mayo Clinic, University of Florida, Shands Cancer Center, Moffitt Cancer Center, as well as University of Miami Sylvester Cancer Center. We are really excited to build on these findings that we presented at ASCO and further improving the outcomes of our patients, not only that we see and serve here in South Florida, but statewide or across the globe.
Mammy, that's just a remarkable synopsis of the brain tumor work that you've done and our group has done and MCI has presented. I'm also proud to say that at ASCO, Miami Cancer Institute physician investigators also presented work in breast cancer and lung cancer, bladder cancer, and HPV-related cancer. So we've gone from just a few presentations at ASCO 3 or 4 years ago to this year, there were over 50 presentations at ASCO, something we are all incredibly proud about. But I want to change the subject a little bit, and I'd like you to talk about your specific work with the next generations of physicians. Can you expand on what the work you've been doing with fellows, how they presented, and how we should invest in the next generation of physicians?
Definitely, Dr. Zenner, as you prior to coming to Miami Cancer Institute, were leader of surgery at Brigham's and the Dana-Farber Cancer Institute. And the way we build in serving our patients today is by training the next cadre of physician leaders for tomorrow. And building on your vision, we have had a several group of fellows who've been working with us looking at various outcomes of patients, not only at Miami Cancer Institute, but looking at national databases, mining databases from the Guardian Research Network. And several of these analyses led to abstracts that were presented at ASCO. And a lot of findings of these analyses are helping us ask new questions that we are now interacting with, whether we're putting in new grants at the federal agency level, putting grants at the state level, working with pharmaceutical companies to design the next cadre of clinical trials, asking this question of how can we improve on the existing cancer care that we provide to our patients every day. I was also very fortunate to have served as the faculty for the young trainees at ASCO to actually have them walk over all the posters that were presented at ASCO in the CNS tract. That's the central nervous system tract. And it was so exhilarating to see these young talent from all over the globe were coming really at ASCO, which is the biggest playground for oncology. There are close to 50,000 people there, and the energy is so palpable. And I think we have all come back really invigorated to work harder for our patients to transform their outcomes. And I think our fellows really bring a tremendous amount of energy to our team every day at Miami Cancer Institute.
Well, that's a tremendous way to close. I will say we're very, very proud of you. I mean, we are in the clinical business, we are in the research business, and we are in the teaching business. But as you just highlighted, we're also in the young people business, and that's our future. So I'd like to thank you, Manmeet. I'd like to thank you for your incredible hard work, your vision, and all the contributions that you make, not only to us, but to the world of cancer and cancer research. Thank you.
Thank you so much, Dr. Zinner, for your vision, your fearless leadership, and setting a very high bar for us and our team here at Miami Cancer Institute to serve patients not only from South Florida, the Caribbean, and the beyond.
To find out more about the topics covered on the Doc to Doc podcast, please visit physicianresources.baptisthealth.net.